شاشة واضحة. تمام. الكل يعرفه ساعة 12. تمام. Okay, Assalamu alaikum. Today we will have our last lecture regarding the MSS module, and we are going to talk about bacterial skin infections. You know, we have started with different types of infection: fungi, anaerobic, viral, parasitic. Today we are going to talk about bacterial skin infections. We are going to describe the common bacterial skin and wound infections, study pathogenesis, cultural characteristic, antimicrobial effects of different commensal and pathogenic bacteria. Mainly, we are going to talk about Diphthroids, Staphylococcus, Streptococcus, Propane Bacterium, and Mycobacterium. And lastly, we are going to detect what type of specimen we can collect for identification of these microorganisms from the skin or wound infections. Starting by skin and wound infections, there are a few terms I would like to clarify them to you from the beginning. When we say folliculitis, it's a minor infection of what? Of the hair follicles. And usually at areas where friction is present and excessive sweating, sweat gland activity are very active. So at this area, you get infection of the hair follicles. This is how it looks like, folliculitis. From the name, folliculitis, hair follicle infection. Now, if this infection of the hair follicle progressed to be with it small abscesses like this one, from these minor infections, and we will have this small abscess. Please, anyone open the Zoom connection should shut it because we get background voices. Please. So here we call this infection of the follicle with abscess, we call it furuncle. So what is a furuncle? Infection of the hair follicle with abscess formation. Usually single. This single lesion or solitary abscess formation become multiloculated فيها تفرعات كثيرة, we call it carbuncle. So folliculitis, furuncle, and carbuncle. Impetigo, or sometimes called pyoderma. What is impetigo or pyoderma? There will be a small vesicle, حبة صغيرة, which will rupture, which contain fluid, of course. When ruptured, with skin erosion, serous exudate will be liberated. This serous exudate, when dry, become crusted, تصير زي القشور, honey colored, بلون الهاني. It is superficial skin infection. You can see it like that. It is very contagious. So we have talked about superficial layer of the skin. Now, if we go deep in the dermis, we get a condition called erysipelas. Is rapidly spreading infection of deeper layer of the dermis. Look here, We have reached to the dermis. Plus what? In erysipelas, edema, erythema, pain, fever, lymphadenopathy. The area become more superficial gradually, will be raised, demarcated than cellulitis. There is another condition called cellulitis, and we will see the difference between erysipelas and cellulitis in a moment. So it is infection of the dermis, remember, with edema, erythema, pain, fever, lymphadenopathy. This is how it looks like the erysipelas. It is caused by streptococci, group A streptococcus, beta hemolytic. There is diffuse erythema and the swelling of the face of this woman, and it is usually caused by group A streptococcus, which is beta hemolytic. Now, what is cellulitis? It is an acute inflammation of what? Of the subcutaneous connective tissue. Now, deeper. Erysipelas was infection of the dermis. Now we go deeper into subcutaneous tissue. There will be swelling, pain, marked by constitutional manifestation. So this is not infection of the skin, of the subcutaneous tissue. To this condition, look to this condition, acne vulgaris, حب الشباب. There is inflammation of the hair follicles associated with infection of the sebaceous glands. الغدد العرق الدهنية تبع السكن. Sebaceous glands. There is a blockage of these glands. Now, this table is very important, and I would like you to know only the first microorganism, the leading microorganism, the most important microorganism, and wound infections. Fungi and others, these are rare conditions. So impetigo, it is caused by group A streptococcus, mainly. Folliculitis, Pseudomonas aeruginosa, mainly. Acne, حب الشباب, Propane Bacterium acnes. From the name, you can look. Propane Bacterium acnes. Furuncle with pus, Staphylococcus aureus. Cellulitis, as we have seen, and erysipelas also, group A streptococci. Intertrigo, in between the skin folds, you get Staphylococcus aureus. Chronic ulcers, Treponema pallidum, one of the spirochetes that cause syphilis, مرض السفلس. Chronic ulcer caused by Treponema pallidum. Very simple. I would like you to know only the first name of this table for each category. Very simple. Wound infection, the wounds infections could be surgical wound, could be traumatic, could be physiologic, could be endometrial injury of the uterus. The traumatic wounds could be due to cuts, deep cuts, compound fracture. I mentioned to you compound fracture. It means when there is a fracture of the bone, it's open to the outside. It breaks the skin and open to the outside. Frostbite necrosis. frost معناتها الثلج أو الصقيع. So frostbite necrosis. thermal burns, الحرق. These are all traumatic wounds that can happen to the skin. Sources of wound infections، يعني منين جاية هذه الميكروبات اللي بتعمل wound infection؟ from own microbiota. You know, the body contains a lot of microbiota on the skin, in the mouth, in the nose, etc., in the ears, in the intestine, and so on. So, own microbiota. Or it comes from infected individuals or carriers from others, or from the environment. These are the main sources of wound infection. Now, similar to what we have done for the skin, now we are going to do for the wounds. What is the main microorganism? In case of a trauma, a Clostridium. Surgical clean wound, Staphylococcus aureus. Surgical dirty wounds, ملوثة, Staphylococcus aureus also. Burns, remember in burns, Pseudomonas aeruginosa, which is usually in burns multi-resistant microorganism to varieties of antimicrobial agents. Animal bites, for example, bite of a cat, Pastorella maltosida. Pastorella maltosida. So you have to remember only one name, the first name for each category. Clear? Now let us talk about diphthroids. What are these diphthroids? Microorganisms, look at them in the picture here. These are non-pathogenic Corynebacterium. You know Corynebacterium diphthery, أخدتمها بالريسبيراتوري. Corynebacterium diphthery, it can cause diphtheria, مرض الخناق, which is very dangerous disease. There are category of Corynebacterium called diphtheroid, زي ما تقول كتاب وكتيب. Diphthroids. These are non-pathogenic microorganisms, commensals, present in the pharynx, nasopharynx, distal urethra, and on the skin also. That is why we are studying them. These are gram-positive aerobic bacteria, non-spore forming, rods. So these are rods. You can see them bacilli. These are small, there will be, these produce small non-hemolytic colonies on the blood agar, so they cannot cause hemolysis of the blood. These microbes are sensitive to penicillins, cephalosporins, and erythromycins. Because these are gram-positive, so of course they will be sensitive to penicillin, cephalosporin, and erythromycin. Staphylococcus. You know Staphylococcus, مرت عليكم في كثير من الأحيان. Just to highlight a few points. These are gram-positive, present in a cluster زي العناقيد. These are catalase positive, which differentiated from other microbes. There are coagulase positive microorganisms, which cause hemolysis, beta hemolysis on the blood agar, and can grow on mannitol salt agar. They are mannitol fermenter. So these characteristics indicates Staphylococcus aureus. So how we know this staph is aureus? It should be coagulase positive, beta hemolytic, can grow on mannitol, salt agar, and ferment mannitol. All these characteristics indicates Staphylococcus aureus, which are coagulase positive, because there are other staph which are coagulase negative, which are not Staphylococcus, like Staphylococcus aureus. For example, Staphylococcus epidermidis. Now, treatment, Staphylococcus aureus, the most resistant microbe to penicillin. They are called methicillin-resistant Staphylococcus aureus, MRSA. You remember, I have taught you this with your general microbiology, MRSA. Most resistant. Why resistant? Because they produce beta-lactamases, penicillinases enzymes, which can destroy the penicillin. So when you treat such infections, you have to use beta-lactam drugs which are penicillinase resistant. For MRSA, you have to use what? Vancomycin. And you have also to use, sometimes if you don't have vancomycin, you can use anti-staphylococcal resistant drugs, for example, fluocloxacillin, which can resist destruction by beta-lactamases. You can see the clusters, gram-positive, cocci. Remember, these are cocci. This is the mannitol salt agar. Staphylococcus aureus can ferment the mannitol. The original color of the media is pink or red color. It changed the pH of the medium and become yellowish. The media and the colonies. So if you see yellowish colony on mannitol salt agar, this is the Staphylococcus aureus. The one which cannot ferment mannitol and stay pink is Staphylococcus epidermidis, which is, I said, coagulase negative. Staph aureus, as I said, can cause beta hemolysis. If you culture it on a blood agar, it can cause beta hemolysis, which is the complete hemolysis of the blood present in the agar, in the plate. So let us put features, just general feature for staphylococci. We talk about coagulase, alpha toxin, super antigen, habitat where they are present, whether they can cause biofilm, boils, UTI, deep infections. Staphylococcus aureus, coagulase positive. It has alpha toxin, yes. It has super antigen, an antigen which can stimulate the immune system excessively. Where we can detect them in carriers, anterior nares في بداية الأنف. يعني أنت إذا بدك تعرف نيرس عندك في المستشفى تحمل هذه الميكرو أورجانيزم اللي تنقلها للمرضى, you can take sample from the anterior nares, sometimes from the back of the wrist, because some of these nurses, some of these people, they put the back of the wrist on their nose. Also in the perineum, they can cause biofilm. What is biofilm? Growth on surfaces. Boils, yes, very important cause of boils. الحبيبات اللي فيها pus في الجلد, in the skin, usually Staphylococcus aureus. Can cause urinary tract, very rarely, not. Negative UTI. Deep infection can cause pneumonia, osteomyelitis, abscesses, Remember, Staphylococcus aureus is pyogenic microorganism and also can cause toxic shock syndrome, TSS. What is TSS? Toxic shock syndrome. I will come back to this term in a moment. Staph epidermidis, coagulase negative, no alpha toxin, no superantigen present on anterior nares and skin. Can cause biofilm, boils not, UTI not, may contaminate devices يعني أجهزة طبية أجهزة أنستيزيا أجهزة endoscopy etc. staph saprophyticus اللي موجودة في الطبيعة يعني هيك أيضا the same thing as epidermidis coagulase negative alpha toxin negative super antigen negative present in the gastrointestinal tract cannot cause biofilm not boil but UTI yes mainly in immunocompromised patient deep infection cannot because saprophyticus في الطبيعة others not important for us okay. So remember, Staph aureus, Staph epidermidis, Staph saprophyticus. A clinical capsule. You remember I always put attention to the clinical capsule. Infection by Staph aureus could be acute, very aggressive. There will be local destructive purulent. What is the meaning of purulent? Pus formation. This is pyogenic microorganism. The most familiar infection common boil الحبيبات اللي تظهر على الجلد painful lump in the skin which has necrotic center and fibrous shell. Infection in organs other than the skin can cause infection of the lungs, kidney, bone, and these infections could be focal and destructive and can go deeper in tissues to involve many organs, especially when spread to the blood. Such systemic infections are characterized by high fever, systemic toxicity, which may be fatal in a few days. There is a subgroup of Staph aureus, less than 10% of them. They can produce toxins. You have seen in the table, they produce toxins. And in addition to those caused by the primary infection, the symptoms can spread to different parts of the body. Diarrhea, rash, skin desquamation. Skin desquamation معناتها تقشر الجلد. Multi-organ involvement and can lead to toxic shock syndrome, TSS. This is the point that I would like you to know. They can lead to TSS. I will speak about TSS in a moment. So ingestion, sometimes they have enterotoxin, and we have mentioned Staphylococcus aureus in the food poisoning, you remember, with the GI system. So I am not going to go through it. But remember, TSS, toxic shock syndrome. So locally, boil, pyogenic, purulent, destructive. When it goes systemically, it can involve many organs with fever and toxicity and can lead to TSS. So you can see here the different infections that I have mentioned illustrated in these pictures. This is infection of the follicle, and here Staphylococcus aureus, how it can enter and how can reach deep and form abscesses. You can see it here. Okay, this is multiloculated abscess. This is carbuncle. We said multilocular abscess. The furuncle become carbuncle. Furuncle يعني single abscess. Furuncle single abscess. When become multiloculated, تنتشر تتشعب, it is called carbuncle. This is a syndrome called staphylococcal scaled skin syndrome. شبيه بالحرق. يعني انت من تشوف الطفل هذا تقول عنده حرق، هو مو حرق. staphylococcal scaled skin syndrome معناته staphylococcus aureus can cause staphylococcal scaled skin syndrome and can cause toxic shock syndrome. Two syndromes. This infant have abscess of the breast, and from these abscesses, Staphylococcus aureus has spread. You know, we said that Staphylococcus aureus can cause abscess formation. As if this child has been put in boiling water. كأنما محروق. This is a staphylococcal scale. So if I say to you, this child have got a breast abscess, what do you think? Abscess usually caused by Staph aureus. And Staph aureus will spread from these lesions in the breast and cause this devastating scaled skin syndrome. Now let us put things all together. Staphylococcal scaled skin syndrome, 4S, and toxic shock syndrome, TSS. TSS. The 4S is an illness characterized by red blistering skin that looks like a burn or scald. This condition is caused by release of two exotoxin by Staphylococcus aureus, epidermolytic toxin A and B. So caused by epidermolytic toxin A and epidermolytic toxin B from toxigenic strains of Staphylococcus aureus. So staphylococcal scaled skin syndrome is caused by toxigenic strains of Staphylococcus aureus. Toxic shock syndrome shows fever, rash, skin peeling, تقشر الجلد, low blood pressure, why? Shock, and symptoms of a specific underlying infection. This syndrome, TSS, is caused by toxin 1 super antigen, and we said Staphylococcus aureus has got super antigen. So toxin 1 super antigen that can stimulate numerous T cells. This condition can be triggered by menstruation or tampons infected. Tampons يعني الحفاضات, which can enhance toxin release from Staphylococcus aureus. So different categories, I would like you to pay a lot of attention to these two clinical categories caused by Staphylococcus aureus. I will come back again to TSS in a moment. Remember, here we have spoken about Staph aureus, but I will speak about Streptococcus pyogenes, which can cause the same condition, TSS. So Streptococcus gram positive arranged in chains. حكينا أيضا سابقا أنه it is arranged in chains زي السبحة. Streptococci can be of different effects on blood in case of hemolysis. It could be alpha hemolysis, which is partial hemolysis, a green in color, and beta hemolysis and gamma hemolysis. Gamma, there is no hemolysis. Beta, complete. Alpha, partial. They are grouped according to the Lancefield antigen. Lancefield عالمة وحدة بالميكروبيولوجي اسمها ريبيكا لانسفيلد عملت different types of antigen A, B, C, etc. Well, nowadays it has been substituted by other ways of typing. Example, group A, Streptococcus, beta hemolytic. Beta hemolytic يعني complete hemolysis. Group A streptococci can also cause toxic shock syndrome as Staphylococcus aureus. So remember, Staph aureus and group A streptococci can cause TSS. Treatment, penicillin G, because these are gram-positive erythromycins, not aminoglycosides. These microorganisms are naturally resistant to aminoglycosides. So don't give aminoglycoside to these infections of streptococci. Like chains, okay, gram-positive cocci in chains, end to end. The chains are arranged. They can be oval cocci. Sometimes these chains can be broken into 2 or 3. Some of them are long chains, you can see. Gram-positive Streptococcus, this is. Of course, we cannot know this is a group A Streptococcus, except when we culture it and find its characteristics. Here we say only gram-positive Streptococci, not more. This is beta hemolysis. Look, this is the colony. Around it, the blood, this is a blood agar, okay? Here around the colony, the blood has been completely hemolyzed. So beta hemolysis. So we can say group A, beta hemolytic streptococci, beta hemolysis of group A. Clinical capsule, group A streptococci can cause what we call it strep throat, يعني التهاب البلعوم. اوكي، التهاب البلعوم او الحلق. Sometimes can go to the pharynx deeper and go to the tonsils, okay, and cause tonsillitis. If I ask you what is the most common cause of acute tonsillitis, you will say to me group A, streptococci, beta hemolytic. The patient will have fever, pain during the swallowing. Skin and soft tissues infection range from tiny pustule, which is called impetigo, you remember, impetigo, which is caused by group A streptococci, to toxic, very severe condition and invasive disease, which is called toxic shock syndrome. In addition to the acute infection, the group A streptococci are responsible for inflammatory diseases that are not direct infections, but represent a state in which the immune response to Staphylococcus antigen injured the host. For example, يعني الجسم من يكون أجسام مضادة للستريبتوكوكس بايوجينز. طبعا بالمناسبة جروب A beta hemolytic streptococci are called streptococcus بايوجينز. تعلموها هذه وخلوها في بالكم. جروب A streptococci beta hemolytics are called Streptococcus pyogenes. This Streptococcus pyogene can cause acute rheumatic fever. حمى الروماتيزم اللي تصيب المفاصل اللي تبدأ بتونسيلايتس وتنتقل للجسم. الانتي بوديز اللي تتكون ضد الستريبتوكوكس will cross react with the heart muscles and cause carditis. It can cross react with different tissues, can cause acute glomerulonephritis, which is characterized by hypertension, hematuria, proteinuria. Also can cross react the antibodies with the joints. So rheumatic fever starts as tonsillitis, and then after 2 to 3 weeks, it is complicated by infection or inflammation of the heart, carditis, of glomeruli, acute glomerulonephritis, and of the joints, arthritis. So streptococci can cause strep throat, can cause skin infection, impetigo, TSS, or go systemically, right? Propane Bacterium, and we have spoken about the Propane Bacterium acne. It is related to the acne formation. Acne يعني حب الشباب. These are gram-positive, aerotolerant, but anaerobic bacilli. Aerotolerant anaerobic bacilli can tolerate some air, but they are anaerobic. These are part of the normal flora commensal of the skin. They live in and around the sweat and sebaceous glands. Sebaceous gland is quite associated with acne formation because of the blockage of the sebaceous gland. So it is linked to the acne and can live in facultative anaerobic condition. These are, when you culture them, these are slowly growing in cultures. They take about more than 6 days to cultivate them. Treatment, these we said gram-positive, so we use antibiotics which are active against gram-positive, like what? Erythromycin, tetracycline, clindamycin. Alternatives could be fluoroquinolones, cephalosporins. Also, you can use some chemicals to clear the acne, antimicrobial chemicals. So these are gram-positive, okay, gram-positive bacilli, I said, rods, and you can see them like that. Mycobacterium. I am not going to speak about Mycobacterium tuberculosis اللي تسبب السل الرئوي, pulmonary tuberculosis or others. I am going to talk about mycobacteria which are related to skin infections. Mycobacterium marinum. Mycobacterium marinum causes skin granuloma. They are photochromogene mycobacteria. What is the meaning of photochromogene? When you expose the culture to light, for example, like sunlight or light, special light in the laboratory, they produce yellow, orange color on light. That is why they are called photo, it means light, photochromogene. They change their color to yellow, orange. So if I ask you, what's the meaning of photochromogene? Meaning of it, the growth of this microorganism becomes yellow-orange in color when exposed to light. These mycobacteria lives in water and in fish, so can be transmitted to human being via these routes. Mycobacterium ulcerans causes severe skin ulceration. These are environmental microorganisms around us, mainly at tropical areas في المناطق الحارة. Tropical areas يعني المناطق الحارة، المناطق الاستوائية. Mycobacterium leprae التي تسبب داء الجذام، وراح ناخذها مع CNS2. بس علاقتها مع السكين now, it can cause lesions variable from tuberculoid to lepromatous lesions. Tuberculoid, it means localized زي الجرانيلوما تبع التوبركلوزس. To lepromatous, very widely spread. فمعناتها إما تكون local على شكل جرانيلوما أو spread over the skin, many areas. And this is related to the number of CD4 T cells and their response against the infection. If the patient have good response with CD4, with many CD4, the patient will have a tuberculoid, localized infection, a granuloma. If the CD4 cells are low, like what happened in HIV infection, of course the patient will spread the infection and become lepromatous, leprosy. Mycobacterium leprae can cause a disease called leprosy, داء الجذام. The treatment of this condition, we will speak about it in CNS2 in details, but for the moment, dapsone and rifampicin. Dapsone is a special drug for Mycobacterium leprae, and rifampicin or rifampin we call it. This is lepromatous leprosy. You can see the lesions widely spread on the body. And even the patient has lost the eyebrow, al-hajib, and sometimes they lose the eyelashes, and the skin become thick, and it infects the lobes of the pinna of the ear. So if you would like to take a smear, you can take it from the lobe of the ear. It has a rich microorganism. A skin scraping, if you do, you will get this microorganism, which is acid-fast bacilli. These are acid-fast. So you have Mycobacterium, especially Mycobacterium tuberculosis, is acid-fast, and also Mycobacterium leprae is acid-fast bacilli. What is the difference? In Mycobacterium leprae, we use modified acid-fast. Modified acid-fast. I'm sure you have tackled this in your laboratory with the general microbiology last year. Last slide, and we finish the lecture. How we take a skin sample for bacterial testing. A dry, sterile cotton swab. Look at the swab. This is cotton at the end here. And this is a tube to put the swab in it, just to keep it clean and deliver it to the laboratory. So I'm sure you will have this in the laboratory soon, and it will be explained to you. But just summary for it: a dry, sterile cotton tip swab rubbed on the skin area, a blister or dry skin, lesion or pustule, and you take your sample with the cotton, and then you put it in the tube. There are other types of swab, moist swab. فيها مادة زي الجلي مرطبة للسواب taken from mucosal surfaces. This can be used for mucosal surfaces such as inside the mouth. يعني إذا بدك تاخذ من الجلد تاخذ dry sterile cotton swab. إذا تاخذ من الماوث أو mucous membrane من النوز مثلا تستعمل moist swab. Sometimes we use aspiration of fluid or pus. عندك lesion بيها pus. You do aspiration. Aspiration can be done with syringe from a skin lesion using needle and syringe. Also, you can do skin biopsy, a small snip sample of the skin. وخزة بسيطة هيك وتاخذ قطعة صغيرة من السkin. This is called a skin biopsy. So these are the main ways of taking sample from the skin: a dry sterile swab, moist swab, aspiration if you have a fluid or pus, or you can do a skin biopsy. If you have any question. This is my last lecture to you, and we are going to meet on Sunday, يوم الأحد القادم, and we'll have our small group discussion for all of you. Any question? Please do ask. Very interesting lecture. I tried to simplify it for you. Just you read it and you will be okay with information of this lecture. If you don't have any question, I will end this session and hoping to you all the best and success, inshallah, in your examinations. Assalamu alaikum.